Using the DSM-5, an 8-year-old child with persistent and frequent irritable episodes of behavioral outbursts that are grossly out of proportion in intensity or duration to the situation is most likely to be diagnosed with A. Bipolar disorder, B. Oppositional defiant disorder, C. Autism spectrum disorders, D. Disruptive mood dysregulation disorder. D. Disruptive mood dysregulation disorder. Disruptive mood dysregulation disorder is a relatively new diagnosis included in the DSM-5. It is characterized by chronic and severe irritability, frequent temper outbursts, and an overall dysregulated mood. The key feature of DMDD is that the child's outbursts are disproportionate to the situation and occur across different settings. This diagnosis is typically made in children between the ages of 6 and 18. Given the child's persistent and frequent irritable episodes that are grossly out of proportion to the situation, the most likely diagnosis would be disruptive mood dysregulation disorder. Sarah, a 25-year-old woman, seeks help from a mental health professional after experiencing a recent episode of severe depression. During the assessment, she discloses a history of suicidal thoughts and reveals that her mother had attempted suicide in the past. Additionally, Sarah shares that she has moved frequently throughout her life due to her father's job. The mental health professional considers the risk factors associated with suicide attempts and evaluates which factors may increase Sarah's risk of attempting suicide in the future. Based on the information provided, which of the following can increase Sarah's risk of attempting suicide in the future? A. Prior suicide ideation. B. Past suicidal behavior in one's family. C. History of frequent mobility. D. All of the above. D. All of the above. Options A, B, and C are all suicide risk factors. Option A, past suicide ideation, increases the chance of suicide attempts. Sarah's prior suicide impulses make her vulnerable. Option B, family suicide, is also a risk factor. Genetic and environmental variables may increase Sarah's risk owing to her mother's suicide attempts. Option C, frequent movement, while not directly connected to suicidal conduct, can raise stress, disruption of support networks, and difficulty establishing lasting social ties, which may negatively affect mental health and increase suicide risk. The mental health practitioner acknowledges Sarah's various risk factors by picking option D, emphasizing the need for a complete assessment, intervention, and continuous care to reduce her suicide risk. A social worker is working with a client named Alex, who recently disclosed that they are living with HIV but have not informed their partner about their diagnosis. Alex has expressed reluctance to disclose their status and consistently refuses to use barrier protection during sexual activities with their partner. The social worker recognizes the potential risk of transmission and the importance of informed consent. What should the social worker do in this situation? A. Respect the client's decision and maintain confidentiality, as long as there is no immediate risk of harm to the partner. B. Collaborate with a healthcare professional to ensure comprehensive care for Alex while prioritizing their safety and respecting their feelings. C. Contact the partner directly to inform them about Alex's HIV status and the potential risks involved. D. Consult with a supervisor or seek professional guidance to determine the most ethical course of action. D. Consult with a supervisor or seek professional guidance to determine the most ethical course of action. This scenario presents a complex ethical dilemma involving confidentiality, informed consent, and potential harm to others. Given the potential risk of transmitting HIV to the partner, it is important for the social worker to seek guidance and supervision to ensure they are acting in an ethical and responsible manner. Consulting with a supervisor or seeking professional guidance allows the social worker to consider the legal and ethical obligations, review state laws regarding disclosure, and explore options that prioritize both client autonomy and the well-being of the partner. It is essential to have a collaborative and informed approach to navigate this challenging situation. Samantha is a social worker who is working with a client named Emily, a 32-year-old woman who is seeking therapy for her struggles with anxiety and decision-making. During their sessions, Samantha emphasizes the importance of the ethical concept of self-determination. In this context, self-determination refers to a. Emily's right to do anything she wants to do, regardless of consequences. B. Emily's right to require others to help her achieve her goals, even if it imposes on their boundaries. C. Emily's right to make choices that may endanger the well-being of others. D. Emily's right to personal autonomy and decision-making, respecting her own values and preferences. D. Emily's right to personal autonomy and decision-making, respecting her own values and preferences. Self-determination is an important ethical principle in social work that emphasizes the rights of individuals to make their own choices and decisions about their lives, based on their values, preferences, and goals. It recognizes the intrinsic worth and dignity of every person and upholds their autonomy. Self-determination does not imply the right to do anything one wants without regard for others or to require others to assist in achieving personal goals. It also does not grant the right to make choices that endanger the well-being or safety of others. Therefore, the most accurate description of self-determination is the right to personal autonomy and decision-making. Amy, a 28-year-old woman, has been hospitalized for severe hallucinations. The treating psychiatrist has determined that medication is necessary to address these symptoms and ensure her successful transition back into the community. Considering the client's condition, which medication is the most likely to be prescribed to Amy upon her discharge? A. Zoloft, B. Prozac, C. Abilify, D. Xanax. C. Abilify. Abilify, aripiprazole, is an antipsychotic medication commonly used to treat hallucinations associated with psychotic disorders such as schizophrenia and bipolar disorder. It works by balancing certain chemicals in the brain to reduce hallucinations and other psychotic symptoms. Given that Amy is being discharged with medications to address her hallucinations, Abilify is the most appropriate choice as it specifically targets psychotic symptoms. The other answer choices, A. Zoloft, B. Prozac, D. Xanax, are medications commonly used for other mental health conditions such as depression, anxiety, and panic disorders, but they are not primarily prescribed for hallucinations. Therefore, Abilify is the most likely medication prescribed to Amy in this scenario. Emma is a social worker who has recently started working at a community mental health clinic. She is assigned to work with a caseload of clients with various mental health concerns. As a new practitioner, Emma is seeking guidance and support to enhance her skills and knowledge in providing effective services to her clients. Her supervisor, Lisa, understands the importance of clinical supervision in supporting Emma's professional growth and development. In the context of the case scenario, what is the primary aim of clinical supervision? A. Ensure that clients' issues are reviewed with more experienced practitioners. B. Improve social workers' skills and knowledge through professional development. C. Ensure that clients receive the most efficient and effective services possible. D. Prepare social workers to serve as mentors of new professionals in the future. B. Improve social workers' skills and knowledge through professional development. Clinical supervision is primarily aimed at enhancing social workers' skills and knowledge through ongoing professional development. It provides a structured and supportive space for social workers to reflect on their practice, discuss challenging cases, receive feedback, and engage in learning opportunities. Through clinical supervision, social workers can improve their clinical skills, expand their understanding of theoretical frameworks, stay updated on evidence-based practices, and develop effective strategies for working with clients. By continuously enhancing their skills and knowledge, social workers can provide better quality services to their clients. Therefore, The primary aim of clinical supervision is to improve social workers' skills and knowledge through professional development. Sarah, a social worker, is working with a client who is struggling with addiction. During their sessions, Sarah emphasizes the importance of building a strong therapeutic relationship, maintaining professional boundaries, and providing quality services. She also ensures that her actions align with the code of ethics governing social work practice. Sarah is committed to upholding the professional code of ethics in her practice. Which of the following values is not explicitly stated in the social work code of ethics? A. Service. B. Importance of human relationships. C. Integrity. D. Advocacy. D. Advocacy. While advocacy is an important aspect of social work practice and is often aligned with the core values of the profession, it is not explicitly stated as a separate value in the professional code of ethics. The Social Work Code of Ethics explicitly emphasizes the values of service, the importance of human relationships, and integrity. These values guide social workers in their commitment to providing ethical and effective services to individuals, families, and communities. However, advocacy, although an inherent part of social work practice, is not explicitly mentioned as a separate value in the Code of Ethics. It is important for social workers to understand and adhere to the core values outlined in the Professional Code of Ethics, as they provide a framework for ethical decision-making and guide the practice of social work. You are a mental health professional conducting an assessment on a 32-year-old client who has been experiencing episodes of extreme mood swings. The client describes periods of intense euphoria, increased energy, and impulsive behaviors, followed by episodes of deep sadness, low energy, and feelings of hopelessness. Based on the client's symptoms, you are trying to determine the main factor that distinguishes bipolar 1 from bipolar 2. Which of the following is the main factor in the difference between bipolar 1 and bipolar 2? A. Bipolar 1 involves mania and bipolar 2 involves primarily depression. B. Bipolar 1 involves primarily depression and bipolar 2 involves mania. C. Bipolar 1 involves hypomania and bipolar 2 involves dysthymia. D. None of the above. A. Bipolar 1 involves mania and bipolar 2 involves primarily depression. In bipolar 1 disorder, individuals experience episodes of mania characterized by elevated mood, increased energy, and impulsive behavior. These manic episodes can alternate with depressive episodes. On the other hand, bipolar 2 disorder involves episodes of hypomania, which are less severe than full-blown mania, and major depressive episodes. This distinction highlights the difference in the dominant mood states between the two disorders. Options B and C are incorrect as they do not accurately reflect the distinguishing features of bipolar 1 and bipolar 2. Option D is not the correct answer because there is a significant difference between the two disorders. A social worker is conducting an assessment of a 3-year-old child and their parents. The parents express concerns about their child's difficulty with separation, especially when they have to leave for work or when the child is dropped off at preschool. The child becomes visibly distressed, clinging to their parents, and expressing fear and anxiety about being apart from them. At what age does separation anxiety typically begin? A. 24 months. B. 18 months. C. 12 months. D. 3 months. C. 12 months. According to developmental psychology, separation anxiety typically emerges around 12 months of age. It is a normal part of a child's development as they start to recognize and form strong attachments to their primary caregivers. During this stage, children may exhibit distress and anxiety when separated from their caregivers. The other answer choices, A, B, and D, are not accurate as separation anxiety is not typically observed at such early stages, 3 months, or as late as 24 months. A woman comes into your office expressing concerns about a compulsion that has been affecting her social interactions. Whenever someone brings up a serious topic such as a family death, loss of a job, or major illness, she feels compelled to use humor to minimize the intensity of the situation. Upon further assessment, you discover that the client's mother used to reward her with praise and attention whenever she made jokes in difficult situations during her childhood. Looking at classical conditioning theory, the reinforcement provided by the mother for using humor can best be described as A. Unconditioned stimulus, B. Unconditioned response, C. Conditioned stimulus, D. Conditioned response. A. Unconditioned stimulus. In classical conditioning, an unconditioned stimulus, US, is a stimulus that naturally and automatically triggers a response without prior learning. In this case, the mother's praise and attention served as the unconditioned stimulus because it naturally elicited a positive response from the client without any prior conditioning.
The other answer choices, B, C, and D, are not applicable in this scenario as they do not accurately represent the role of the mother's reinforcement.
I hope this video has been helpful in deepening your understanding of social work license exam questions. If you're interested in taking your studies further, I invite you to join me for a 90-minute session where we'll dive deeper into the various content areas and practical applications. When you sign up, you'll also receive my 70 Social Work Practice Exam Question ebook and my Strategies for Success activity book, both of which will help you continue your learning journey. Head over to my website, gilbertmbell.com. The link to sign up is in the description below. Or text the word study to 347-683-7923. I look forward to studying with you and helping you become the best social worker you can be. Thanks again for watching.